So Ralph, I understand you spend a lot of time in your office sitting down. Have you realized what your posture is like?
I try to sit up straight, but I don't think I'm aware of how my posture is like.
Well, let's do this little challenge. What I want you to do is to lean against the wall, and then you lower yourself down such that your thighs are parallel to the floor and your shin bone is perpendicular to the floor. And then you put out your hands and hold this posture for 1 minute.
Okay.
So Ralph, how do you feel?
My legs.
Well, this is a very good exercise to test your thigh strength and to maintain your back posture. So if you're intending to take up any physical activity this coming winter, especially skiing, it's a very good exercise to start off with.
Hip and knee injuries can be misunderstood as injuries mostly related to the elderly. But is that true? Let's find out more from Dr. Leong, orthopedic surgeon from Gleneagles Hospital. Dr. Leong, is it true that hip and knee injuries are predominantly an age-related orthopedic problem?
That is certainly not true. A lot of times we see patients from 20 years and above presenting to us with hip and knee injuries. The hip and the knee joints can be fairly complex structures and we take a lot of it for granted. Most often in the knees, these patients get the injuries when they're in a half-bent position and they pivot or they turn upon the knees, and this results in a tear of the ligaments and the shock absorbers, otherwise known as the meniscus. In the worst case scenario, they can damage the cartilage. Hip injuries are less common, but the more serious one involves a tear of this structure called the labrum, which is a lip of tissue that surrounds the socket of the hip joint. Some of these injuries can be serious enough to warrant surgical intervention.
So, what can we do to reduce hip and knee injury?
Well, I think it's very important that the patient should be in good physical condition before he engages in the sport. If he's taking a sport for the very first time, he should get adequate training for it, and they should always start off gradually. So for example, if you intend to run a marathon, you start off with gradual runs first at a slow pace, and then from there you gradually build up your speed and your distance. You should also do warming up before and warming down after the activity as well.
Some of us may just ice, put on plasters, or pop painkillers and put off seeing doctors. But when should we see a doctor?
Well, most patients will have an injury before in the past, for example, like ankle sprain. So if a patient experiences pain beyond what they normally will experience, the joint is extremely swollen, or the joint is stuck in a position what we call locking, they should take the opportunity to seek further medical consultation. So for example, in the knee joint, we have here, this is the kneecap, this is the thigh bone, and this is the shin bone. The blue represents the cartilage. There are 4 ligaments, 2 on the outside, 2 on the inside, and 2 shock absorbers, which are these structures that help protect the cartilage, also known as the meniscus. Patients can either have a fracture of the bones, a tear of the ligaments, or of the shock absorbers. On the worst case scenario, they can actually damage the cartilage, and that can lead to osteoarthritis. These are some of the things to look out for when we see a patient.
That's how you take care of your hips and knees, everyone. If you think your legs are stronger than mine, take the challenge and share your results with us on Instagram at #Topofyourgame.
Before you start on the challenge, check with your doctor to make sure you are certified fit to continue on the challenge. If you feel any discomfort during the activity, stop and do not attempt to continue. If you are cleared and confident of carrying on, start small and build on your successes slowly. All the best.